Did you know that over 50% of acute liver failure cases in America are caused by medications that millions of seniors take every single day? That's right, the very pills prescribed to help manage your health conditions could be secretly damaging your liver without you experiencing a single symptom until it's too late. And here's the most terrifying part. Many of these drugs are FDA approved, available over the counter, and taken with complete confidence even though science has repeatedly shown they can devastate your liver's delicate cells. Your liver is your body's silent workhorse, filtering blood, metabolizing medications, detoxifying chemicals, and producing vital proteins that keep you alive. But unlike your heart or lungs, your liver doesn't scream when something's wrong. It whispers, until it's too late. Liver damage can develop for years with no obvious symptoms. No pain, no warning, until it suddenly manifests as jaundice, chronic fatigue, cirrhosis, or even liver failure. One moment you're feeling fine, the next you're facing an irreversible diagnosis. In this video, we'll reveal the 6 most common medications silently shutting down your liver, starting with the least damaging and ending with the most dangerous one, the medication you probably took this week without thinking twice. And at the end, we'll also reveal the top 5 foods that actually help cleanse and protect your liver, and why doctors now recommend these to their own families. Trust me, you'll want to stick around for that part. Before we begin, let us know in the comments where you're watching from, and don't forget to like this video and subscribe to our channel for more content like this. Now, without further delay, let's get started. Medication number 6. Ibuprofen, Advil or Motrin. You've probably got it in your medicine cabinet right now. Ibuprofen is one of the most widely used non-steroidal anti-inflammatory drugs worldwide. Sold over the counter, people take it for everything from back pain to headaches to sore knees. But here's the catch. While ibuprofen temporarily relieves pain, it can seriously damage your liver over time, especially if you're over 60 and take it regularly. Your liver must metabolize every drug you swallow, including ibuprofen. During this breakdown process, toxic byproducts called reactive metabolites are created. These molecules cause oxidative stress in your liver cells, essentially creating chemical chaos that inflames and scars liver tissue. Here's the kicker. Your liver can handle small amounts of these metabolites when you're young and healthy. But as you age, your liver's detoxification ability weakens, blood flow slows down, enzyme activity decreases, and these reactive metabolites accumulate like uncollected trash. This is particularly dangerous if you take ibuprofen daily for chronic pain or combine it with other liver-metabolized medications. The result? A gradual buildup of liver inflammation that can progress to non-alcoholic steatohepatitis, a form of fatty liver disease leading to fibrosis and eventually cirrhosis if unchecked. A major study published in the journal Hepatology found that regular NSAID users had significantly higher liver enzyme elevations, a clear early marker of liver damage, compared to rare users. Even more concerning, many seniors take ibuprofen without food, increasing the drug's blood concentration and forcing the liver to work harder. And because it doesn't carry the stigma of prescription drugs, people assume it's safe long-term. The reality is different. Ibuprofen might seem like a harmless solution for arthritis pain or backaches, but it's a wolf in sheep's clothing for liver health, especially when taken for weeks or months without medical supervision. If you're using it daily, think twice and discuss safer alternatives with your doctor. Medication number 5. Amoxicillin and other common antibiotics. You've probably taken this dozens of times in your life, perhaps recently for a sinus infection, dental issue, or bronchitis. Amoxicillin is among the most frequently prescribed antibiotics for seniors and is generally considered safe. But here's what most people don't know. Certain antibiotics, especially amoxicillin, Augmentin, amoxicillin plus clavulanic acid, and others in the penicillin family, can cause a unique type of liver damage that develops silently. This injury is known as idiosyncratic drug-induced liver injury, meaning your liver can react badly even at the correct dosage, and there's no way to predict who will be affected. It's not about taking too much, it's about how your body uniquely metabolizes the drug. When your liver breaks down amoxicillin, it can trigger unusual immune responses. Instead of calmly processing the drug, your liver's immune cells may overreact, mistaking the drug or its byproducts for threats. This leads to unexpected liver inflammation, damaging delicate tissues. The damage doesn't always show immediately. In many cases, symptoms like fatigue, dark urine, or abdominal discomfort may not appear until weeks after finishing the antibiotic. The scary part? Some seniors develop full-blown cholestatic hepatitis, a condition where bile flow from the liver is blocked, causing toxic buildup. It's rare, but when it happens, recovery can take months or may not happen at all. According to a major analysis in the Journal of Clinical Gastroenterology and Hepatology, amoxicillin clavulanic acid was identified as one of the most common causes of antibiotic-related liver damage in older adults. The risk increases dramatically if you're taking other medications that burden the liver or have undiagnosed pre-existing liver issues. Yet this antibiotic is often prescribed casually. Got a cough? Here's amoxicillin. Sore throat? More amoxicillin. But few patients are warned about the potential liver consequences. If you've taken it multiple times in the past year, consider discussing liver enzyme levels with your doctor. What seems like a minor prescription could be gradually eroding your liver health without any symptoms until the damage is done. Medication number 4, statins, atorvastatin or simvastatin. This one will surprise you. Statins are prescribed to millions of seniors yearly to lower cholesterol. If you're over 60, your doctor has likely offered you one. Drugs like atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, are household names in medicine cabinets nationwide. For some people, they effectively reduce heart attack risk. But here's the hidden cost many doctors don't clearly mention. Statins can be very taxing on your liver, especially with long-term use. Here's why. Statins work by blocking an enzyme in your liver that helps produce cholesterol. That's right, cholesterol isn't just from food. Your liver actually makes it. By shutting down this pathway, statins reduce blood cholesterol. This sounds great in theory, but your liver doesn't like being interfered with. When statins disrupt normal functions, your liver can respond with inflammation, enzyme elevations, and in rare but significant cases, severe liver damage. Worse still, liver-related statin side effects often go undetected for months. You won't feel sharp pain or get alerts. The damage accumulates quietly, like termites undermining your home structure. Some people develop statin-induced hepatotoxicity, where liver enzymes spike and tissue becomes inflamed. This appears in blood tests as abnormally high ALT or AST levels, signs your liver is struggling to process the drug. Critically, the risk of statin-induced liver damage increases with age and skyrockets when combined with other liver-metabolized medications like blood pressure or diabetes drugs. That's why regular liver function monitoring is essential if you're taking statins. Don't assume they're harmless just because they're common. And don't hesitate to ask your doctor if lifestyle changes like a Mediterranean diet rich in olive oil and greens might be equally effective with fewer side effects. When your liver starts showing warning signs, it usually means damage has already begun. Medication number 3, methotrexate. This might sound less familiar, but if you or someone you love has rheumatoid arthritis, psoriasis, or certain cancers, you might already be taking methotrexate. It's a powerful drug that effectively reduces inflammation and slows disease progression, but comes with major red flags for liver health. Methotrexate is metabolized almost entirely by the liver and is well documented to cause liver fibrosis and cirrhosis with prolonged use. Let's break that down. Fibrosis means your liver is developing scar tissue in response to repeated injury, making it less efficient. Cirrhosis is worse, permanent scarring that can lead to liver failure, internal bleeding, and potentially death. What makes methotrexate particularly dangerous for seniors is that the drug accumulates more easily as liver and kidney function naturally decline with age. Your body can't clear it as quickly, so it lingers longer, causing more damage each time it's processed. More troubling still, early signs of methotrexate-induced liver damage are easy to miss. You might feel fine, you might even think your arthritis or psoriasis is well controlled, while your liver silently deteriorates. That's why methotrexate patients should get liver enzyme tests every month or two, but many don't, with serious consequences. Even dosage matters. Low-dose methotrexate, often prescribed for autoimmune diseases, is sometimes presumed safe, but research from the American Journal of Medicine shows that even low doses can cause liver damage over time without careful management. The kicker: methotrexate can also reduce the liver's regenerative ability, meaning once damage occurs, it may not heal as a healthy liver would, like punching holes in a sponge that can't bounce back. If you're on methotrexate, have frank conversations with your doctor about your liver. Ask about regular monitoring and folic acid supplementation, which can sometimes help reduce liver stress from methotrexate. Medication number 2, diclofenac. This one's a sneaky villain. Diclofenac is an NSAID like ibuprofen but with an even more concerning reputation. It's commonly prescribed or recommended for arthritis, muscle pain, or joint issues, especially for seniors. You might recognize brand names like Voltaren, available in both pill and gel forms. It's heavily marketed as a safe, effective chronic pain remedy, and for many older adults struggling with aching knees or stiff backs, it seems like a lifesaver. But here's the scary reality. Diclofenac has one of the worst safety records among NSAIDs regarding liver health. Studies spanning more than 2 decades consistently link diclofenac to hepatotoxicity, literally meaning toxic to the liver. Unlike ibuprofen, which causes mostly mild and gradual liver strain, diclofenac can trigger full-blown liver injury relatively quickly. Research published in the British Medical Journal and Drug Safety ranks diclofenac among the top prescription drugs associated with liver failure requiring hospitalization. The damage is often cholestatic hepatitis, a liver injury where bile can't flow properly, causing toxic substance buildup in the liver and bloodstream, leading to jaundice, intense fatigue, and dark urine. Sometimes this develops after just weeks of use. Sometimes it takes months, but once it begins, the process can escalate rapidly. What's particularly concerning is that many seniors use both oral and topical diclofenac simultaneously, not realizing that even the gel form absorbs into the bloodstream and adds to the liver burden. This can overwhelm your liver, especially if you're already taking other liver-stressing medications like statins, blood pressure drugs, or over-the-counter painkillers. And because diclofenac remains widely prescribed and available in some over-the-counter products, people often underestimate its risks. Medication number 1. Acetaminophen, Tylenol. This might shock you more than any other. Tylenol is often viewed as the gentle, go-to pain reliever, especially for seniors avoiding the stomach issues caused by ibuprofen or aspirin. It's ubiquitous, in cold medicines, sleep aids, arthritis pills, but here's the frightening truth. Acetaminophen accounts for an astonishing 50% of all acute liver failure cases in the United States. Yes, you heard correctly. Not alcohol, not street drugs, but acetaminophen, the innocent-looking pill you probably took just last week. Here's why it's so dangerous. When you take acetaminophen, your liver breaks it down. Most processes safely, but a small percentage converts to a toxic compound called NAPQI. Normally, your liver uses glutathione to neutralize NAPQI and protect itself, but there's a limit. If you take too much acetaminophen, or even normal doses over extended periods, your liver can deplete its glutathione, allowing toxic NAPQI to directly attack liver cells. The terrifying part for seniors? As you age, your liver's glutathione production naturally decreases, meaning you have less defense against NAPQI even at supposedly safe doses. You could be taking the recommended amount and still gradually harming your liver without realizing it. Consider that many seniors take multiple acetaminophen-containing medications without knowing it: cold and flu remedies, prescription painkillers, nighttime sleep aids, and the danger multiplies. It's easy to accidentally exceed the maximum safe limit, especially when managing chronic pain with several daily pills. According to the FDA and studies in The Lancet, tens of thousands suffer liver injury from acetaminophen annually, with a significant proportion being older adults who never considered themselves at risk. Liver damage begins subtly: unusual fatigue, mild nausea, or slight upper abdominal discomfort, but can rapidly progress to full-blown liver failure requiring hospitalization or even transplantation. What makes this particularly insidious is the perception of safety. You don't think twice about taking Tylenol, it's doctor-recommended, but science tells a different story. A drug potentially extremely dangerous if overused, misused, or simply used too frequently, especially in people over 60. If you're taking acetaminophen daily or even every few days, particularly combined with other medications, it's essential to review all your pills with a healthcare provider. That innocent white tablet could be doing far more damage than you think. Foods to regenerate liver. There you have it, the 6 common medications most harmful to your liver. But it's not all bad news. Certain foods can give your liver what it needs to repair and effectively filter toxins. These 5 natural liver allies are scientifically supported, readily available, and genuinely beneficial. If you're concerned about liver damage from any medications we've discussed, adding these to your daily routine is one of the smartest, simplest steps you can take. Food number 1. Beets. These deep purple root vegetables contain powerful betaine compounds that reduce oxidative stress and liver inflammation. What makes beets truly special is how they improve blood flow and support detoxification. Beets help your liver break down toxins more efficiently and stimulate bile production, your body's natural fat emulsifier and toxin eliminator. Consuming fresh beet juice or roasted beets several times weekly can make a real difference. Some studies suggest beetroot extract improves liver enzyme levels in fatty liver disease patients. Food number 2. Garlic. This humble kitchen staple does more than flavor food. Garlic contains sulfur compounds that activate liver detoxification enzymes and help flush heavy metals and drug residues from your system. It also provides selenium, a key antioxidant mineral enhancing your liver's natural defenses. Just 1 or 2 cloves daily, raw or lightly cooked, can support liver enzymes and reduce inflammation. Garlic also boosts your immune system, which is closely linked to liver health, especially in older adults. Food number 3. Leafy greens. Spinach, kale, arugula, and collard greens are packed with chlorophyll, the green pigment that helps cleanse bloodstream toxins. They neutralize heavy metals and harmful chemicals from medications, processed foods, and environmental exposure. Leafy greens also provide magnesium and potassium, minerals that maintain bile flow and prevent fatty deposits in your liver. A daily large salad or morning green smoothie easily delivers exactly what your liver needs. Food number 4. Turmeric. This golden spice has been used for centuries in Ayurvedic and traditional medicine for liver problems, and now we understand why. Curcumin, the active compound giving turmeric its bright color, has potent anti-inflammatory properties. Curcumin reduces liver inflammation, helps regenerate damaged liver cells, and prevents fat accumulation. One study in Liver International found that people taking curcumin supplements showed significantly lower liver enzyme levels, a marker of reduced liver stress. You can take turmeric supplements or incorporate it into soups, teas, and stir-fries for natural benefits. Food number 5. Avocados. Creamy, delicious, and surprisingly powerful for liver health, avocados contain healthy monounsaturated fats that reduce liver fat accumulation and boost glutathione levels, the same antioxidant your liver uses to neutralize drug toxins like napki from acetaminophen. Avocados are also rich in fiber and potassium, supporting healthy digestion and weight management, both critical for liver function. Just half an avocado daily can measurably improve liver enzyme levels over time. We want to hear from you. Have you or someone you know experienced unexpected side effects from these medications? Which of these 6 medications surprised you most? Share your experiences and thoughts in the comments below. We love hearing them. Thanks for watching.